We're talking today with John Morahan, President and CEO of St. Joseph Regional Health Network. John, thank you for taking time today.
Sure, Dan.
Healthcare obviously is in the news a lot these days. Let's talk about the election and what does the fact that Obamacare seems to be now here to stay? What are the implications for that for St. Joseph?
Well, the implications that the law is here to stay only creates the certainty of the changes that not only St. Joe's has been making, but other hospitals throughout the country in terms of transformation of how healthcare is moving really to deliver value or high quality outcomes for patients rather than, and not to say that high quality is not being delivered, but the incentives in the system currently are on volume. So we're moving from a fee-for-service payment system to a system that will pay for value.
In practical, everyday terms, what will that mean for the hospital?
That we will be transforming our way that we deliver health care for the public. We have been doing that, but it'll even be more demonstrable as we partner with our physicians and other providers in the community like rehab centers to really transform the way that we deliver care so that high quality outcomes are produced, that indeed the value is going to be in the form of being paid for outcomes and taking on risks that those outcomes are being produced. So rather than being paid for every x-ray, every lab test, every doctor's office visit, and really the center of our system right now is really focused on acute care where the biggest payment is if you're hospitalized. There's only going to be one payment for certain disease states such as congestive heart failure. And so with the one payment that we, and the adherence that you have to deliver high quality outcomes to receive that payment, then indeed it's almost like construction where there's only one price to get the building built, but you have to pay the electrician and you have to pay the plumber and you have to pay the carpenter.
Right.
Much the same, that's how this system is transforming. It will be like that in terms of both chronic disease states and then as we move in through this transformation in terms of taking care of the full person in terms of population health.
That's the first time I've heard that metaphor, comparing it to construction, where you have like a one big project payment and then you've got the subcontractors who each get their piece of it once the thing is done.
Yeah, so if you think about, I'll give you, to kind of bring that more into a clearer focus. So the way that congestive heart failure, which is a cardiac disease, is treated is that it's diagnosed more than likely by a primary care physician through a series of tests. Then you're referred to both perhaps a pulmonologist or a cardiologist. They're going to prescribe tests. They're going to prescribe imaging. And it's okay as long as everybody's getting paid for all this testing and these office visits, which is our present system. And then they're sick enough where they have to come to the hospital for more intervention as well as to help cure them of the incidence of the disease. They have a chronic condition, so once you have it, you won't be purely completely cured, but you can manage it. So you're in the hospital, that's more testing, and then you perhaps go to a rehab center to rehab before you get to go home, and oh, by the way, here comes home health to help you.
Right.
All those are components of care that all have their discrete payment system. What the Accountable Care Act does, and these pilots have been occurring even during the Bush administration, so it's not really new, but now it's the law, is all those care will be bundled together in one payment. And so then it becomes incumbent upon all of those physicians, hospitals, home health, rehab centers working together for the betterment of the patient, because there's only one payment and that payment has to be divided up amongst all those entities.
This is not a topic that's easy to discuss in 5-minute chunks, so you've done very well to help me understand some of that. Quickly, your name is St. Joseph Regional Health Network. Reading Hospital just announced their new branding. The emphasis seems to be on establishing a regional identity and perhaps even trying to widen your market base. What do you think the implications of that are for small community hospitals?
Well, in terms of those hospitals that see themselves as only hospitals, just acute care, and that haven't brought in their components of care, such as establishing ambulatory diagnostic facilities, adding physician practices, both primary and specialty, and even if they're not employing them directly, but having legal organizational mechanisms to align with the private doctors in like what it's called a physician hospital organization. Not having partnerships with either rehab facilities, partnerships with home health. Those are the ones that will suffer as these transformation takes place.
Become potentially targets of acquisition?
Yeah, well, there's, and eventually I'll tell you why that is in terms of the acquisition. So the Accountable Care Act, there are 3 distinct movements that are occurring, and they're not perfectly linear in terms of those movements. So the first movement that's occurring right now is as I mentioned in the beginning, is to reduce your costs, but more importantly, make sure that you're consistently performing and delivering high quality outcomes. So highly effective delivery systems is the first movement. And then indeed, that also involves being sure that you have the information technology in place, because sharing of information across all of these entities is critical. Because at the end of the day, if you look at medicine, it is about the training and education, but what do doctors and hospitals and pharmacists and any clinical professional, it's about the information. You apply the information to cure the patient and to make that patient's life better. So sharing information does help, not only in terms of curing the patient, but sharing that information ensures that you're only going to do 1 x-ray rather than 5 x-rays. Right. That's basically it. So this first movement, I think a lot of hospitals are moving in this direction. But when I mention IT technology, it also is very, very important because that's a very large capital infrastructure cost.
It's expensive. At
the same time, the Accountable Care Act, starting January 1st, particularly, but for Pennsylvania hospitals, for example, and you probably have heard this, there are set payment cuts in Medicare that are coming that will total approximately $7.5 billion for Pennsylvania hospitals over the next 10 years. That, it pales in comparison to if we go over the fiscal cliff. And what that means is that there's an automatic 2% cut in Medicare across the board. Right. That's another hundreds of millions off the table for Pennsylvania hospitals. For doctors, it means that they incur, and you probably have heard this, their physician fee schedule has been projected to be cut by over 20% starting 3 years ago. The figure right now is over 27%.
For seeing Medicaid patients.
Medicare patients. Medicare.
Yeah.
So what one has to do if you're a hospital or a health system or a health network is you have to start transforming yourself to be highly effective and consistent in delivering high quality outcomes. The second movement, which becomes more severe, noting the cuts that I mentioned under the Accountable Care Act, you have got to be very cost efficient and you have to reduce your cost of the delivery of service. So such things as, Dan, when you cover other companies and they talk about applying lean methods that Toyota has done, for example, to be more cost efficient so they can produce a car that is affordable for a family. Much the same, hospitals are employing those types of manufacturing techniques in terms of
operate more efficiently.
Correct, in terms of providing patient care from the ED through the floors, but also doctors' offices as well are and will be employing those types of techniques.
Let me just stop you there. we're almost out of time. I wanted to ask you one more question about...
The third movement is population health, but that could be a whole nother day.
If you were invited into a room with all the bright people to talk about healthcare and what one thing you might change to the Affordable Care Act to make it work the way people hope it works, what would you put at the top of the to-do list?
I would say that a coherent strategy so that all providers, physicians, hospitals, clinicians have a common information technology platform to deal with. Because right now that's a very disconnected piece. So it would be to capitalize and to have been more foresightful of both the cost of and the need to have a uniform platform to develop the information technology capability so that we could all share information, and ergo that would reduce dramatically the cost of care.
Is it still possible to do that? Or are we too far down the line?
We're too far down the line. I think it will be revisited maybe in 10 or 12 years. They're going to stumble on this. Everybody's undercapitalized in terms of IT,
Right.
and we have disparate systems. I can name the top 5 for you. But because it's not uniform, we are all lurching towards meaningful use in different ways.
And we'll let that be the last word.
Okay.
Thank you.
Dan, thank you. Thanks very much for the opportunity.